Dr. James Olobo-Lalobo. I'm a consultant fertility specialist working in Paragon Fertility Center. I also double up as a consultant in medical law and ethics, and I've just completed drafting the draft regulation for IVF-assisted reproductive technology and presented it to the Uganda Medical Council. Further to this, I'm also the Vice President of the African Fertility Society, and in October this year completed the development of fertility guidelines at WHO, and this worldwide WHO guideline is due for publication and release before the end of the year. For a woman unable to have a family, it is quite devastating. And this is the critical area in terms of health. And if we define health in terms not only of disease, but also a complete absence of social and welfare being as well. If we recognize the fundamental issue that reproduction is a natural human right, it is also protected under Uganda's constitution. Further, we lay a lot of emphasis in the constitution as well on the rights of a woman to reproduction. We particularly recognize that aspect because they often face the social burden of infertility, including in many situations where the husband is responsible for infertility. So we can construct infertility as a disease, but I also recognize that infertility is also a social problem because a child is constructed by the parents biologically, but the child constructs the parents socially. It defines the mother's femininity, it defines her social standing. And it also gives meaning and depth to the stability of a family, apart from looking at infertility from a disability point of view in terms of the stigma and the social consequences of childlessness. And most of this is driven by men. Why do I say it is by men? Men control the economic power. They control the social system. And many of them who do not realize that the modern technology can now convert them into fathers, proud fathers, do not realize that the important thing today in the modern world is for the man to climb down as well as to come down. This is the message you should take forward to the rest of the nation. There is therefore a social gap. What are the fundamental social aspects which feed into and relates productively with modern medicine? And in many cases where we use assisted reproductive technology, some of which leads to the occurrence of twins. In many situations, people will say this is a complication. But in an environment where twins are revered, we would accept the assisted reproductive technology, having a couple of twins, in order that there are many more salongos for that reason. But there are also negative consequences of social impact on health, particularly the stigma to women. But in terms of modern medicine and modern technology, IVF and assisted reproductive technology, I think the greatest beneficiary are men who would have ordinarily been categorized as infertile. It is now possible for them to father a family through micro manipulation technique. The blunt or the cutting edge, the other alternative edge of this sword is that it is very expensive and it is not readily available for everybody who requires it in Uganda. Most of the clinics are, first of all, limited to Kampala only, with only one clinic out of the 7 clinics in Uganda operating upcountry. Secondly, it is only being offered in the private sector. The government hospitals has not established a single high technology fertility treatment. So there is a big gap, and that gap needs to be overcome rapidly by injection of investment and also training. I take this opportunity to demonstrate the practical steps taken during an IVF or assisted reproductive technology. The process, in fact, starts before theater. It starts with the diagnosis of the patient, the woman, and the husband. It is then followed by the process of stimulation of the ovaries. At this film now, I will demonstrate a lady who has had the ovaries stimulated and now comes in for retrieval of the eggs. The process will be called egg retrieval. I now demonstrate that the patient is lying on the green operating table before me. To my left-hand side is an ultrasound scan, and I'm holding the scan probe on my left hand. You can see in my right hand, I'm holding the retrieval mechanism, which in this case is looking like a tube. But in the real sense, you use a fine needle, which is passed through the lady's tummy. The direction of manipulation is demonstrated by the scan, which I'm holding on my left-hand side. If I position my needle in the ovary, which has been stimulated, containing maybe up to 10 eggs, I will then use the connecting mechanism in the tube on my right hand to remove the ovary, including the fluid surrounding it, into the machine which is standing over my right shoulder. You can identify two machines on that. One is the suction machine, and the other on the right-hand side, which contains the test tubes, is the heating stage to maintain the body, the temperature of the eggs which have been taken. I would repeatedly do this process maybe between 8 to 12 times to get and recover all the eggs which have been stimulated. And this process is called egg retrieval. It will require a short general anesthetic, and in an experienced hands, this process lasts about 15 to 20 minutes. After which, the lady and the patient would be removed out of the operating table into the recovery, which takes about 30 minutes to 1 hour. And generally 1 hour after this procedure, the lady will be ready to go home. And that is completed as a day procedure. She does not need to stay in the hospital overnight.